You're about to watch an exercise that uses your neck and your eyes plus a little bit of stretch to help you break free from stuck stress in your body, your neck, your head, and it will connect you back into circuits of feeling grounded, calm, and peaceful with less pain. My name's Dr. Renee Ostertag. I am a physical therapist and a psychotherapist, which makes me like a nervous system ninja, and I love empowering you with skills, exercise, tools, strategies for you to think, feel, and behave more like a ninja yourself. All right, folks, it is salamander progression time. Thank you again, Stanley Rosenberg, for the exercise, salamander. I'm Dr. Renee Ostertag. I'm a physical therapist and a psychotherapist. This is Susan. She is going to be showing us how to progress your salamander. You've seen the first one, basic in sitting. You're now at a place where you can do it and it doesn't evoke discomfort or stress in your body. So it's time to progress. The progression of salamander that I like to do first is in sitting with overpressure. So go ahead and side bend your head to one side. Oh, let's first, you, viewer, do a baseline assessment of something. Just notice your body, notice how you're feeling. That's how we know if things work, right? Is you do a test before and after. So get some sort of baseline measurement. How's your breath in this moment? How does your body feel in this moment? How is your range of motion in this moment? Just notice what you're aware of and remember the one that's sticky or glitchy so that you can retest it after you do the salamander with overpressure. You got your measurement? Mm-hmm. Okay, so go ahead and do your side bend to the side. I'm going to show you the progression. So the first part is to bring your left hand gently on the side of your head here. And you don't need to put a lot of pressure in here. Just very gentle, like a baby. And you're just encouraging an elongation on the side of your neck that's getting stretched. Okay, so that's option one for overpressure. And now you can look with your eyes out the corner of either your left, towards your left or towards your right. And you're just going to hold 10 seconds, 20 seconds, 30 seconds. For some people, this will feel easy and no problem. For other people, this will be provocative. This will elicit feelings of discomfort, tension, stress, gross, like nauseated, feeling off, feeling funny. All that's normal. If you need to back off, please do. I do encourage you to go into a mild amount of discomfort that you can still breathe through. If you're forcing and pushing, you're going to have a counter effect, right? Because you're going to resist the unwinding that's happening in that reptilian response. Again, after the exercise is done, oftentimes there's like a wave effect where you feel a little symptomatic for 10, 20, 30 seconds, up to 3 minutes is well within my acceptable window of tolerance. Susan, I'm guessing you were feeling a little something during and after, and now has it all settled itself out?
It's still trying to settle.
It's still settling, yeah. No problem. Let it take the time that it needs to take. You are unlocking a freeze response that's stored in the body with this. And when a freeze response occurs chemically, there's a lot of hormones that get trapped and locked into the neuromusculoskeletal respiratory system, right? So your body's holding all these like intense fight, flight, freeze, survival hormones, stress hormones. And when you're doing this reptilian unlock, this salamander exercise, you're unleashing, letting out back into circulation all those hormones. So it's kind of like vomiting. You're gonna feel gross. How's the wave? Is it settling itself out?
Yes.
Okay.
Yeah.
If it's taking more than 3 minutes, back off, do less. Okay, so that's option one, is to have that hand on the side of the head. Notice your baseline assessment, right? The thing that you checked before, how is it now? If it's better, great. If it's worse, back off. If it's the same, keep going with whatever you were doing. There's a second part of progressing overpressure that you can do. Now be sensitive, be mindful, right? Let your body have reps that it needs at one level before progressing to the next. Right now, I wouldn't add more to Susan because I can tell that was enough. But we're recording a video, so I'm gonna make her do a little bit more, and it's your job to tell me if it's too much, okay? So the second part of overpressure that you can do you wanna do the same side or the other side?
We'll do the other side.
We'll do the other side. Okay, so now go ahead and side bend your head to the right, and you're gonna bring your right hand over and place it on the side. And so now you're bringing an elongation effect here. Now you're gonna take your left hand and put it on the side of bring it up in front. Okay, and you're gonna actually impart a little bit of a side bend force in your thoracic spine. So now you're really opening up this side of the body by compressing this side of the body. So you should feel a more intense stretch as you're coming across and pulling in that direction. So Susan's coming across, she's imparting a lateral flexion force there on the spine, right? So this side's elongating, this side's compressing, this side's elongating, this side's compressing. Eyes are going to whichever side you prefer, right or left. And this is intense. Come on out whenever you're ready, Susan. Just go into it a little bit. That discomfort, you can go more as tolerated. More is not always better. What is, in my opinion, the best is to respect the body's limits. Explore with curiosity. How far into this discomfort can I lean into while respecting the edge? This one often takes a minute, 2 minutes, 3 minutes. Ground yourself, feel your feet, feel your seat, find your breath, keep your eyes closed if you need to. Let that wave pass, right? The stuff that's coming up and wants to get out, let it pass, breathe through it, use your breath to ride that wave. And take your time. Your body has done a lot for you. And this is a way to help your body release some of the stress of all that it's done to serve you in your daily life, all day, every day. Your breath is happening 20 to 25,000 times a day. That's a lot of work happening on your behalf so that you can be alive. And this is a way to be both alive and as well as possible. How are you doing?
Good.
Okay, what are you noticing? Better.
Yeah, just more calm, more flexible.
More calm, more flexible. And just kind of looking at her face, it's almost like a surprise, like, whoa.
Yeah.
Am I reading that right?
Yeah.
Like, I wasn't expecting to feel good. I'm kind of used to feeling kind of tense, kind of tight, kind of stressed. And then we just get used to that physiology. And this is a really kind of deep clean. It's like a street sweeper coming in up and down along your spine, cleaning out stuck old stress. And it can feel surprising to feel something that's not that, right? You might feel more calm. You might feel more peaceful. And I'd encourage you to do a little 12-second soak and savor here and let your body, let your mind get used to these different chemicals. It can feel unfamiliar. It can feel almost unsafe sometimes to feel different states of calm and peaceful. We're not used to it. So let your body get used to the goodness. And if it's not okay with the goodness, go ahead and go on back to the badness, no problem. But know that you can come back to the goodness by doing this salamander with overpressure. If you have any questions, comments, please put them below. I'd love to respond there. My name is Dr. Renee Ostertag. I may or may not have already mentioned that. I'm a physical therapist and a psychotherapist, helping you become a nervous system ninja that can flexibly move through the stressors of life. Have a good day.